everybody, Courtney here from Spa Gregorie's. We know a lot of our guests love to be at their optimal best and as healthy as possible, and we know you guys want that for your children as well. So all you parents out there, pay attention because this video is going to be for you. I would like to introduce to some and present to others Dr. Kevin Priestley from Priestley's Family Chiropractic. Hi, Dr. Priestley.
Hi, Courtney.
How are you?
I'm wonderful. I'm happy to be here. Happy to share this information with the Spa Gregorie family and Priestley Family Chiropractors.
Perfect. Well, we're happy to have you. Now, we got a lot of questions and we were just hoping you can answer a couple of things for us. Is that okay?
We'd love to do that. That's what we're here. A big part of our practice is educating patients.
Okay, so one of the things that really interests us is we have a lot of young women and a lot of women who are pregnant who come to our spa, and we know that you specialize in pediatric as well as prenatal chiropractic care. So I was kind of wondering if you could tell some of those women, our audience, when is the best time for them to come in for chiropractic care?
Even before they get pregnant, we like them to start, like a lot of women start thinking about getting pregnant and they've been on birth control for a long time. We usually recommend them to be off birth control for about 6 months. At that point, we want to get them as healthy as we possibly can. We want them to get off the processed foods. We want them to start exercising and get their body in the best possible shape. We like to check their nervous system to make sure that it's functioning well, and so that it's going to be a great place for that baby to develop. So we believe that even before the conception, that they should start getting under chiropractic care to be as healthy as they possibly can. And it makes it easier to get pregnant.
Okay, so if I'm thinking of having a baby, it would be a good idea just to come in and see how things are and get a checkup and an exam from you just to see where things are at, and then begin the process of possibly prepping to have a baby or prepping my body.
I think that's really smart because we want that body to be as healthy as it possibly can. And the brain controls everything in the body, and if the brain can't communicate to all the organs correctly, it's not going to function as well. You may not even get pregnant because you may not be ovulating because the nervous system's not going to that parts of the body.
Okay, so if I were already pregnant, say I'm a pregnant woman already, what would be the difference in coming in and getting chiropractic care as a pregnant woman versus having an average person who doesn't get chiropractic care?
There's so many benefits to chiropractic care during pregnancy. For one, it's going to make the pregnancy easier and the birth process easier. It speeds up labor and it's a lot more comfortable. You know, you start going through dynamic changes, and chiropractic is going to help your body go through those dynamic changes. It's going to reduce tension in the woman's uterus. All right, and that's fantastic for the baby because it's going to give the baby the room it needs to move around and get into best position for delivery.
Okay.
And also, it's going to improve the maternal functions. Okay, the nervous system controls everything, and so if the nervous system's doing better, there's a lot less chance of some unnecessary intervention like forceps or C-section or vacuum extraction.
Got it. Okay, so let's say I come in and I'm pregnant and I want to get adjusted. What is that going to do for my fetus? Is it going to hurt it? Is it safe to do it while I'm pregnant?
Yes, we do certain techniques, and it's called the Webster, so that it's going to put that woman's body and the child's body into a parasympathetic state. When your body's under stress, it's in sympathetic, it's fight or flight, your adrenaline's going. That's not good for either the mother or the fetus because it's going to raise the heart rate. It's going to take blood from the organs actually and put them into the muscles so that the mom can keep going into that fight or flight. Webster's going to put the mom into parasympathetic, which is rest and digest, growth and development, and that's where that mom needs to be during that pregnancy.
Okay, got it. So let's say I'm doing the chiropractic care, I'm having my baby. How soon after I've had my baby should I be considering bringing my child in for chiropractic care?
As soon as possible. I usually will check, and I'll be at birth sometimes. I'll check that fetus up to 2 hours after they're born, just as soon as I can get to them.
Okay.
All right, for so many reasons. kids under chiropractic care just thrive so much better. They have a lot, they latch a lot better, they sleep so much better, and the body's functioning better. The birthing process at best can cause a lot of spinal misalignments and nerve interference. And so the sooner we get to those, the better the baby thrives and the better the whole household sleeps. If the baby's comfortable, feeding well, growing right, everybody's happy. But if that baby's colicky or not sleeping, it affects the whole house. Not just the mom, not just the dad, but then the grandparents who have to come in and help and give them a break. Or the other kids that might be in the house also. So if you've got a colicky baby, it's going to affect everybody. And so chiropractic's been great with so many things, like problems like lactation, colicky, constipation is another one.
Oh, so I was wondering, you know, as the mom who just gave birth, is it okay for me to also come in for chiropractic care right after, or is there a time period where I should be waiting for that?
No, I recommend as soon as possible. You know, I get a lot of new moms, and it's up in the air once they don't know what's going on, and it takes them a while to get into a rhythm. I strongly recommend that they come in as quickly as possible. You see, during the pregnancy, at the 7th month, the body starts to produce a hormone called relaxin, which is going to relax all the ligaments of the body. It's mainly to help the pelvis open up so the baby can get through there, but it's not specific for that. The ligaments of the feet, the knees, the back, and if a baby is positioned one side or the other, it can turn that spine, get that spine out of position. So we want to get that back as quickly as possible as soon as the person delivers and is capable of getting out of the house and settled into a routine with the baby. We see that happen all the time. And so I offer that to the parents that will check them with both the mom and the kid. If somebody's going through a care plan with me during their pregnancy, one of the things I'll do is I'll go to their home as soon as they're ready for me to check them at my expense, because I think it's so important to do that. And that's my gift to them.
Oh, that's so great. Well, I'm also wondering, you know, after I've had birth and me and my child have been coming, is there a certain point at where my child no longer needs chiropractic care, a certain age perhaps, or?
Well, no, I believe everybody should be under some type of chiropractic care from the cradle to the grave, because there's all kinds of things that cause the spine to go out of position. You've got emotional thoughts that can be stressful. That can cause the spine to go out of position and affect the nervous system. Then there's physical traumas. Think about the average baby learning to walk, falls on their bottom over 2,500 times. Okay? And then if the kids are doing athletics or things like that, there's all kinds. They fall off their bicycle, off their scooters. And so, no, they should be being checked on a routine basis. The kids that are on the chiropractic care have a lot less illnesses. They do better in school because they can concentrate better, and they do better in sports. And so we see it all the time.
Awesome. Okay. Well, let's say I'm a new parent and I'm just walking through the door. Can you kind of walk me through what I can expect and what the process is of getting chiropractic care?
Yes. Are you pregnant? Is it you coming in pregnant?
No, with my child.
Okay. So, with the child, we're going to go through a thorough consultation of how the birth was, starting from when you were planning it, during the first, second, third trimester, how sick you were, whether you weren't sick, whether you sailed through it, how much you worked, and how stressful it was during the pregnancy. And so we'll get that. And so we got to get a lot of information from that so we can know what's happening to the baby while that was in your womb. Then we're going to do nerve scans, and we'll do reflexes on the baby, okay? And for you, we'll palpate your spine. We'll do nerve scans on you, and if we find that it's necessary, we want to see some things that we want to better look at, we will take x-rays on you.
Okay.
They would never x-ray somebody who's pregnant. So a lot of times moms come in during their pregnancy to start, because they either got back pain or they start having some other issues, and so we don't take an x-ray on them. So a lot of times it's the first time we'll have an x-ray on them to really tell what's going on with the spine and the nervous system.
Now, let's say my child is here. What is like the number one issue a lot of parents bring their child in for as far as chiropractic care? Or is there something in particular you tend to see a lot with children?
Well, it's starting with they're not sleeping, okay, or they're having trouble with lactation. They're not latching on. Colic is a big one. Constipation is a big one. irritability, not just, and they don't know why the baby just continues to cry.
Right.
And so those are some of the things we see when the babies are first born come in.
Okay. Now, a lot of people get a little nervous about bringing their kid in because they think their kid is going to be too fussy or won't be able to do a lot of the tests or anything like that. Can you kind of assure the parents that you guys are well equipped and ready for their kids to come in to have a good time?
They're going to have a great time here. We're used to having kids. It's a family practice. We have kids, like I said, from the cradle to the grave. We got the grandparents. So everybody's welcome here, and they have a great time. The kids never want to leave. The parents have to stay here. We used to have a lot more toys before COVID, but they're going to have a good time. We're comfortable with them. We get down on the floor with them. We act as kids, and so they're gonna love it here.
Awesome. Well, I'm ready. Can you walk me through an adjustment? I want to see my kid or my friend's kid get an adjustment. Is that okay with you?
Yes.
Awesome. Let's go do this.